Yep, the recording started.
Thank you, Jesse. All right. Good afternoon. Well, look, starting off already. Starting off wrong already. Good morning. I'm ready for the day to be over already, clearly. Good morning, everyone. My name is Ashley Burrell. I am the Senior Compliance Specialist from the Community Partnership for the Prevention of Homelessness. Thank you so much for joining us for our quarterly all provider meeting. We have some very, very important information for you guys today. We ask that while we're presenting, that everyone keeps their microphone on mute just to avoid any background or unwanted noise or feedback. You can feel free while we're presenting to drop your questions in the chat. At the end of the presentation, we will also have a Q&A where you can provide your questions. So again, thank you for joining us, and let's go ahead and get started. Our agenda for today, we're
Is
going to
somebody
be
talking? I don't hear
some
anything.
transitional housing referral updates, ADA reasonable accommodation information, some compliance updates and reminders, some language access compliance and reminders, some new monthly reports that I know you guys are going to chew our heads off about, some deliverable updates and submission reminders, some contracting reminders, some training updates, as well as some staffing updates. So I think I heard Miss Coates' microphone come on. I'm not sure. Transitional housing referral changes.
Yes, I am on. I don't know why my computer does not like Teams. Thank you everyone for joining. Just in case, just a little side vent session. If anybody else has changed over to the new Teams and it is not acting right for you, you are not alone. It does not work for me. But that's just my own little personal gripe. Another gripe that I know the providers are going to not like me on is there are going to be some transitional housing referral changes. What the district is looking to do is to make referrals to transitional housing programs look more like what it looks like for short term family housing. So there really isn't a lot of detail on how this is going to roll out right now, but the talking points that I have for you to get you up to speed is that they are currently assessing the ways to make this work. And one of the ways that they're looking to do that is to make sure that the by name list that you may have seen in your regular matching meetings for CAP, they're trying to make sure that that is up to date, current, because they'll be using that to make referrals to transitional housing. And they also hope to assist providers with exiting long stayers through this process. So there are going to be some changes forthcoming. So we're going to be getting some more information. DHS looks to have a one pager or some FAQs to be released by the 7th or I want to say it was the 7th. Let me look at my dates. Yes, they're looking for it to be released by the 7th, but let's give a couple bonus days and say the 9th that you should be able to have like a one pager with a lot more information about the change. It's also important to note that this change will come with some site visits by the DHS and TCP. These are not contract monitoring site visits. It is really to get to know more information about your program, how you're operating, and all that good stuff. Of course, we have your program rules, we have your scope of work, all of that is great, but it's different when you have that on paper versus actually seeing it in operation. So once that one pager is released, look for DHS and TCP to schedule some time to come to your site, not again for any compliance monitoring, but to just learn more and understand the operations of your program. Next slide. So this one is also me. It's reasonable accommodation stuff, and I want to talk to all providers about this one. Please keep in mind that I know that there is a reasonable accommodations training, and any information that you gather from these couple of slides, it is not intended to serve as a reasonable accommodations training. It is still required as outlined in your contract. If you haven't attended or you need to attend, um, please look out for the training calendar that is released the last full week of every month. Um, but please keep in mind that this information that I'm sharing is not intended to stand in place of any training. Next slide, please. So I want to say it was March 2023. TCP changed the way that we submit reasonable accommodations to ensure that we are HIPAA compliant. Please do not send me or TCP a reasonable accommodation in an email. It is not, our emails are not HIPAA compliant. Please utilize the Smart Sheet to submit a reasonable accommodation. The reasonable accommodation request, a client will can request them to any staff at your program site, be it verbally or in writing. And if they do this in writing, it can be on the form that we have, it can be in a note that they wrote on a napkin to you. But as the provider, you have the responsibility of transferring that information to the appropriate form for reasonable accommodations. Keep in mind that reasonable accommodations are specific to referring equal access for medical purposes. Anything else, if it is you are doing a change or modification to the time a client can come in because they have a job, if you are doing a modification to anything else for any other reason than medical, it is a modification and it is not considered a reasonable accommodation. What I'm finding is that sometimes we'll hear or we'll get put into some conversation and we'll say a reasonable accommodation when we're talking about making a modification to a program rule for something that it has nothing to do with medical purposes. It's really important to keep in mind there's a difference in the two. And we should not be using reasonable accommodation and modification interchangeably unless it is specific to a medical purpose. One thing I do know is that providers, we have heard that there are too many forms. We need just one document. So our current reasonable accommodation request form does include some options for you to clearly specify if this is a medical reasonable accommodation, if we are doing a modification to honor religious practices, or if we're trying to make a modification to a rule to accommodate a client for some other reason outside of medical. So once you look at the form, there's some check boxes. It's 4 pages. One page is left intentionally blank when you fill out the reasonable accommodations form, and everything should be front and back, same way we do the alternative sanctions like transfer, termination, and suspension. Everything should be front and back. So that's what our form is looking like. And when a client submits to you a reasonable accommodation, providers do not have to send the reasonable accommodation to TCP if it is something that you can honor on your own. An example of this would be a client has come to you requesting a diabetic meal. And they come to you with their prescription for insulin, or they have their documentation from a medical professional that says, this client needs to have a specialty meal um, for their illness. It doesn't have to say, oh, they're diabetic and they need this meal. The treating professional has to give the minimum amount of information as possible, but enough to give you reason to make the accommodation. If you have that, great. You can honor it on your own, and TCP does not have to make a determination. There's some where you may need there are some where we have to make a determination. And that is when we're doing relocations. And I think I'm talking on the next slide. Hit me on the next slide, please. Oh, I wasn't. So I gave you a little bit of ahead information. But once we get it, all reasonable accommodations need to be submitted to us. So I'll jump back into that as soon as I get to animals. So we're seeing a lot of requests for animals in shelter. And I want to make sure we know the difference between an emotional support animal and a service animal. These two animals are not the same. Say it with me, they are not the same. An emotional support animal is an animal. It's typically a dog or a cat, but it can be anything. It could be a snake, it could be a bird, it could be a gerbil, it could be any kind of animal um, that is that provides some sort of like therapeutic benefit to the client, and it's not trained to perform a specific task. This is an animal that has been prescribed by a treating professional for therapeutic purposes. Um, the breed of the dog does not matter. It does not. If they have a dog, it don't matter if it's a pit bull, if it's a Presa Canario, a Cane Corso. It could be a Yorkie. It could be a made up new breed we found yesterday on the street. Any kind of dog, any kind of cat, any kind of bird, snake, anything, but it is prescribed by a treating professional. A service animal under the ADA is specifically a dog, only a dog that has been trained to perform a specific task for the individual. There are two questions that you can ask to find out more about this. And say, is this dog related to a disability that you have? Or you can also ask, is this dog trained to perform a specific task? That's it. Once the client answers those questions, and then you're able to determine that that is a service animal. Where there's the middle, where these both of these animals, regarding the programs, where how this relates to programs and how they fall in the middle, is that no matter what, once you are able to determine whether it is a service animal or an emotional support animal, the client and the animal should not be separated. They have to keep the animal under their control and with them at all times. Vaccination records, all of it, up to district law, which would mean like rabies for 3 years, kennel cough, and distemper, whatever the shots are based on district law for household animals, if it's a dog or a cat. And then the documentation, you need those things, no matter whether it's an emotional support animal or a service animal. So that's where the two overlap in the system. Next slide for me, please. And so, and this is where I was talking about, as the provider, you can approve a reasonable accommodation on your own. The only ones you cannot do on your own, no matter what, I don't care if you have everything that you need, is a relocation request based on a reasonable accommodation. An example of that would be the client now is in an apartment that has 27 steps to get to their unit, but now they can't, the treating professional says they can only climb 5 steps or less. So they now need to relocate. Even if you have that documentation, do not approve that on your own. That needs to come to TCP for approval. If and no matter what, all reasonable accommodations, all of them, whether you approve it yourself or you need TCP to look at it, all of them must come to TCP. We are tracking reasonable accommodations in the system, and without your entry, I can't track it. So back when we first started this system, I asked for providers to put in old information. We didn't get it. Okay, I'm cool. My feelings not hurt. I did cry a little bit on the weekend when it happened, but it's okay. But here we are. I'm still not seeing the reasonable accommodations from providers. And when I think about this, I know somebody that asked for some food that didn't have pork in it. I know somebody asked to be on the bottom bunk. I know somebody then asked to bring in this cane corso. But I ain't seeing it. So if you as the providers could help me out um in ways that you wouldn't even know that you're helping me by just making sure that you upload your reasonable accommodations as they come in and as you approve them, or if TCP needs to approve them. The way to send these to TCP would be through the link that is here, and we can make sure that we can send out the link for the link again for submission to reasonable accommodations. Trying to see if there were any questions. Okay, I see that the link has been added to the chat. Thank you very much. Um, I feel like that might be it on reasonable accommodations. I did see a question in the chat about when will TCP website section on reasonable accommodations be updated? It should already be updated, but hearing you ask this question means that it may not be. So I will take this back to our tech team and see and ensure that it will be updated. Please look for updates no later than the 9th. So we still got you. We still have paper. Like, so the smart sheet is for you to upload the paper documents because we'll still need to collect that. So, but I will make sure that the link and everything gets to our website. And I think that might be it for me for now. I do have one little point on contract and it's not on the agenda because it's a small point. But I'll save that for the end. I'll turn this back to you, Ashley.
Ashley, if you're talking, you're on mute.
Oh, sorry. You guys hear me now?
Yes.
Yeah.
Yes.
Okay, awesome. So these are just some reminders, compliance reminders for URR submissions. You guys are already familiar with the process and expectations for submitting URRs, but just a reminder that all URRs are required to be submitted to both TCP as well as the Department of Human Services within 24 hours from the occurrence of the incident. We're still seeing some delays with URR submissions. Guys, please make sure that you are submitting your URRs within 24 hours. Also, please make sure that you're also submitting to TCP. You guys have gotten a lot better with this, but we do have some that fall through the cracks and they're only submitted to DHS, and TCP is not made aware of the incident until DHS forwards it to us. So please make sure that you are submitting your URRs to TCP as well via the URR Smart Sheet Tracker. When submitting your URRs, please make sure that you're providing as much detail as possible. I think TCP back in the latter part of last year conducted a URR training to go over the expectations for submitting URRs and the documentation that goes along with submitting URRs. So if there's an incident that occurred at your program site that required you guys to take some follow-up steps, please make sure that you're also including that in the URR. If a client was issued a termination notice, please make sure you're providing your support and documentation. a copy of the termination notice. If the client was issued a rule violation notice, make sure you're also attaching that as well. I know that sometimes with emergency termination requests, they are not received, the outcome is not received back from DHS at the time in which you're submitting the URR, which is fine. So you'll see that on TCPs, and when we reach out to you to follow up on the URR, we'll ask for a copy of the compliance finding document, which is the document from the Department of Human Services that indicates whether or not the emergency termination was upheld. So please make sure that you are providing as much detail as possible in any supporting documents, safety plans, etc., along with your URR submissions. Um, just a few reminders on additional reporting trackers that we have. Barring notice tracker. So this tracker is for our sites that are district owned. So if there is an incident and you would like to bar a client from your facility, there is a process for that. There is a barring notice request form that should be completed and submitted to Kimberly Baxter via email at the Department of Human Services. From there, Kimberly Baxter will submit the barring notice request to the Department of General Services. DGS will review the barring notice request. They will approve or deny, submit it back to Kim Baxter, and she will provide you directly with the outcome. So with the barring notice request, please make sure that you are uploading those notices to the barring notice tracker, TCP's tracker. We like to keep track of all of the requests. When we receive the approval back from Kimberly Baxter, we then go into our portal and upload the approval along with your request. So this is just to and keep track of all of the individuals that are barred from which facility. So please make sure you are submitting your barring notice request to the TCP tracker. Now, for facilities that are privately owned, you do not have to go through the process of getting the barring request approved by DGS. If your facility is privately owned, you will have to go through MPD to get your barring notice issued to a client. So this process is different if you have a privately owned building. You would need to contact MPD to set up, a barring uh, approval for a client. So again, this barring notice process, I'm getting some feedback. Can everyone make sure their mics are on mute? Again, the barring notice tracker is only for district-owned buildings. Again, if your facility is privately owned, you will have to go through MPD to get a barring approval for a client. If you have any questions for privately owned facilities regarding barring a client, of course, you can feel free to reach out to me or Sean Billups for guidance, and we'll certainly help out with that. Reminder about TCP's emergency incident report hotline. If there is an emergency incident that occurs at your site, for an example, a power outage for longer than 2 hours, an explosion, if there's a client with a weapon or anything like that, an emergency, a fire, anything like that, that needs to be reported to TCP within 2 hours from the occurrence of the incident. So with the emergency incident report hotline, here's the number documented here. How it works, you guys will contact that number. There is a call center I like to use, or a person that answers that will jot down the incident, and it's transcribed to TCP in the form of an email. From there, when we receive that, we will reach out to you for follow-up steps regarding the emergency incident. This does not replace the process for submitting a URR. So again, with an emergency incident, there's just 2 steps. You guys have to report the emergency incident to TCP within 2 hours from the occurrence of the incident, in addition to completing your unusual incident report, which should be completed within 24 hours. Fatality reports. Here's another tracker as well. If there is a client fatality within your program, that should be reported to TCP in the form of a URR as well as a fatality report. 2 separate trackers. There is a fatality report form. We have been noticing that sometimes programs would just type up a summary or description of the incident and of the client fatality in a Word document and upload that document to the fatality report tracker. And you would get an email from me stating that you have to resubmit. Whenever you submit to the fatality report tracker, the report must be completed on the fatality report form. That form is found on TCP's website. You complete that form and you upload that form to the Smartsheet tracker. So please make sure that when you have a fatality that you are completing a fatality report in addition to URR and uploading the fatality report to the fatality report tracker. Before I move from this slide, are there any questions?
Yeah, there are two questions in the chat. One is based on the reasonable accommodation, so I'll come back to that. Somebody asked for HUD programs. Do you also have to submit to DHS or only TCP for those UIRs?
That is a great question. So for HUD programs, you guys do not follow the URR submission process. You guys do not need to submit your incident reports to the Department of Human Services. For HUD programs, you guys are required to complete a critical incident report. And TCP has a critical incident report tracker, which is separate from URRs that are specifically for HUD programs. That can be found on TCP's website as well. So for HUD programs, you do not need to follow the URR process to submit to DHS. You would just need to submit a critical incident report to TCP. And the instructions for submitting as well as the tracker is found on TCP's website. Are there any other questions just before I move on? I can't see the chat on my end.
No other questions for this. Can I give you the question on reasonable accommodations?
Sure.
So somebody asked, what is the turnaround response for an approval from TCP on reasonable accommodations?
Candace, I'll let you answer that.
It's within 30 days. But preferably no long, it shouldn't take any longer than 15 days. 15 is a magic number, but we have up to 30 days to provide a response.
Thank you, Candace. Any more questions, Jesse, in the chat?
That is it for right now.
Okie dokie. Moving right along. All right.
Oh,
Compliance remind.
Oh,
I'm
sorry, Ashley. We just got
Mhm.
one more. Do security providers need to submit the reports as well? I'm assuming this
So-
is UIRs.
Yeah. So for security vendors, you guys do not need to submit a URR. There is a separate incident report that security vendors are required to complete, and that's through your vendor, the incident report form that you guys have through your vendor. You guys are required to complete that and provide it to the program that you're at, and the program will upload a copy of the security incident report with the URR. So you guys don't have to directly upload it. You guys provide it to program staff, and program staff will upload the security incident report to the URR tracker along with the URR.
And one more question. Could the incident report link? Oh, we put in the chat. Okay, yep, I can handle that.
Okie dokie, we're good to go?
Yep, nothing else right now.
Thank you. All right, compliance reminders, desk audits, and site visits. So, per your contract, guys, each program is subject to an one audit per contract period. An audit can be in the form of a desk audit, which does not involve TCP staff coming to your site. It involves us going into HMIS, looking at some of your client data, case plans, all of that good stuff, doing a review of your deliverables, making sure you checking your data completeness in HMIS. There is a virtual audit report form that you guys are required to submit. So if it's a list of questions on there which requires you to submit photos of certain documents in your facility, things of that nature. Um, Also, there's a site visit, which requires TCP to actually come out to your site. So with the site visit, you guys will be made aware of the site. Well, you you can't. It could be announced or unannounced. So if it's unannounced, we just pop up and do your site visit. But that's usually if there is like a complaint or something like that. We typically like to let you guys know that we're coming because we do understand that you guys have very busy schedules and want to give you guys the opportunity to prepare. So with announced site visits, we give you guys a 48-hour notice. We provide you with a document via email indicating that TCP will be coming to your program site. And we also list all of the documents that we'll be looking for during your site visit. We'll let you know client files or how many client files we would need to look at, employee files, all of that good stuff. And then you guys will be required to sign that site visit notice and send back to TCP. confirming that you acknowledge that we're coming to your site, and also provide us with points of contact for the day of the visit that CCB staff can be in contact with for the visit. So just make sure that you guys are always prepared for an audit. You never know when it's coming. We do have our audit monitoring tools on CCP's website. So if you want to use that tool to kind of test yourself, just to make sure that you're in compliance so you can see what we're looking for, that information is on CCP's website. The desk audit report tool that we use is on there, as well as the site visit report tool. So it kind of gives you a cheat sheet because you get to know what we're looking for. So as I always say, if you stay ready, you don't never have to get ready. So make sure that you guys check that information out to make sure that you're always prepared for your annual audit with CCP. I do want to let you guys know for programs that are funded by DHS as well, they do have their own separate auditing schedule and process. In the past, we have tried to merge those together because we do understand it's overwhelming having an audit from CCP and then 3 or 4 months later, or maybe even a month later, or I've seen sometimes a week later have an audit from DHS. We unfortunately we can't always work it out where we do an audit at the same time as DHS. I know that DHS looks for different things as well, so their audit requirements are different. So I would recommend you to also follow up for programs that are also funded through DHS to check with your contract administrator there for whatever they'll be auditing for because it can differ from TCP. I know with our low barrier shelters, the shelter monitoring unit at DHS completes audits as well. I know that their process is different. I want to say they do theirs on a is it monthly or maybe it might be annual? I'm not too sure, but I know their process is different as well. So again, because you have an audit from TCP, that does not mean it's going to be the same for DHS. So again, just make sure you're understanding of the requirements of what each entity will be looking for. All right, compliance updates, living wage increase. So I want to say last week or maybe the week before last, you guys should have received an email from TCP notifying you guys that as of January 1st, the living wage amount increased. So the amount was $17 as of January 1st, 2024. That amount has increased to $17.05. So this means that all of our district funded programs, you guys should be paying your employees at least $17.05 per hour. TCP will be observing this when you guys submit your staffing list along with your contracts deliverable package to ensure that you are in compliance with the living rate wage increase. If we review your staffing list and we see that someone is making under the $17.05, you will be receiving a email from us looking to rectify that. So please make sure that you guys are staying up to date with the living wage amounts and making sure that you are in compliance and paying your employees accordingly. In addition, so the Living Wage Act is a document. I don't want to say it's a poster because it's like a little small sheet, but this document is required to be posted in your facility, in your office spaces, so it is visible to employees. When TCP completes an audit of your program, we do check to make sure that this document is present. So please make sure that this document is posted and visible in your facility, in your office space, your case management offices or your staff offices or whatever. So it is staff can see the living wage. This link here, and by the way, these slides will be sent out via email to you guys. But if you click this link, it will take you directly to the poster so you can print it out and put it in your facility. The email that TCB sent out about 2 weeks ago also included this attachment. So if you need it again, like I said, you can click this document. It'll take you right to it. Please make sure it's visible and guys, make sure that you're paying your employees at least the minimum wage, the minimum living wage, which is 17.05. Any questions just before I move on? Any questions in the chat?
No questions in the chat. I've been trying to also put the links as they're coming up in the chat for folks.
Awesome. Thank you. Language access compliance. So as a reminder, you guys have to do a monthly report, and this is required for all programs. There's a monthly bilingual staff interaction log. The purpose of this log is to, and it is required from the Office of Human Rights, guys. This is not a report that we just created. It is required The pretty much the district wants to see how often translation services are being provided to non-English speaking and limited English speaking consumers. So this report shows TCP and also the district, because we send this report out, how often throughout the month translation services are being provided to a non-English speaking or limited English speaking consumer. This report is required even if translation services were not provided during a certain month. In the report, you do have there is a space where you can indicate that no translation services were provided. So even if you guys have not provided translation services, you still need to complete the report and submit it. For those who don't submit the report, you guys, get your reminder emails from me, letting you know to submit the report. This report is due the first Friday of every month for the preceding month. So, for an example, your report for January is actually due by tomorrow, which is the first Friday of February. So, if you guys have not submitted your monthly bilingual staff interaction log yet, please be sure to do it because it is due tomorrow for the month of January. Translation interpretation requests. So I want to make sure that all of our providers are aware of this resource that TCP provides. So if you guys need any of your program documents translated into another language to meet the need of one of your consumers. So for an example, if you have a client that's a new client intake and that client speaks Mandarin, and you need your program rules or your intake documents translated into Mandarin, you guys can utilize this tracker to submit the request to TCP to have the document translated. However, I want to make sure that you guys are utilizing your own resources first. So this tracker should be used as a last resort. If you do not have the funds internally to get your documents translated, or if you need an interpreter, an ASL interpreter for a case management session with the client. If you guys are unable to get those resources on your own or fund those resources on your own, this resource can be utilized. But I would like to always remind you guys to try to utilize your own resources to pay for those things. If you cannot, CCP is always here to help with assisting you with getting documents translated into the needed language, or getting an interpreter to your site if you need it for a client. Here's the link to the tracker. I'm sure Jesse's going to also post it in the chat. This information is also on TCP's website. So just want to let you guys know that that resource is available for translation interpretation requests. Any questions before moving on from monthly reporting for language access and the translation interpretation request tracker?
We had a raised hand. Sierra, do you have a question?
Yeah, I had a meeting with me as well, and I just think that like it's hard to pull from everyone's private money, like the money that we have, because it can be sparse to do translation, because translation of like these type of documents is like super expensive, as are interpreters. So to me, it's like if we're having people sign like release of information forms, program rules, and stuff like that, like contract stuff, it just I think at the least in like the 4 basic languages, because then it could be available. You know what I mean? But I mean, I really appreciate this resource, and I think it would be a good idea for DHS to like the spreadsheet. But for so long, I have clients going into programs and like signing things, even like release of information forms, and they're in English. So it's just like I don't know. It should be something I think that is just available in general, because we have clients in our programs who speak the different languages, just to
Mhm.
ensure that they're receiving the same information and know what they're signing.
Absolutely. And that's why we have this resource available. And again, if you guys are unable to, but we do understand that those requests they can get expensive. If you guys are unable to pay for that, this resource is available for TCP to assist. So
Oh, and I love
definitely.
this resource because I was on a meeting with something else recently, and it was like, oh, the turnaround time is gonna be fast and blah blah. So the fact that y'all came up with this is like great. So I appreciate it. Thank you.
Of course. Thank you for that feedback. Any more questions before we move forward? Okie dokie. All right. language access compliance reminders continued. All right, y'all. So the Office of Human Rights, I just want to make sure you guys are aware. The Office of Human Rights at any time can complete a random language access test at any of your sites. So what this test may consist of, it can be someone coming into your site, disguised as a client seeking services, and they may ask for services in Spanish. And the point of that, they want to make sure that you guys are in compliance and will follow through with providing services as needed, utilizing the language access line or a one of your bilingual staff for interpretation. I think was it the beginning of January or late December? We were notified that the Office of Human Rights completed language access testing randomly at a few of our sites, and we were provided with the outcome of the test. So please make sure that your staff is always aware or always aware that a test can occur at any time, and making sure that they have that language access line number available, readily available, or if you guys have bilingual staff that is able to provide services in the needed language available, that's fine too. But at no point can we ever turn a client away for services in another language. So if a client asks for services in Spanish, we cannot tell them we don't provide services in Spanish. You would definitely fail the test. So please make sure your staff is aware. If your staff needs a refresher on language access training, please make sure that you utilize the training calendar to get their staff signed up for the training. But please make sure that your staff is aware that they should be utilizing the language access line to provide services, or a bilingual staff member. You guys cannot turn away a client seeking services if they need services in another language. So again, these tests can happen at any time. They don't notify DHS or TCP when they're doing it. They just do it. Again, they could come into your site or they can call. So again, for your staff that's answering the phones, make sure that they have the language access line information readily available if there's no bilingual staff member available. Also, like I said, the OHR that can come in as a walk-in disguised as a client. Again, make sure your staff is prepared to provide services or utilize that language access line if needed. Any questions regarding this?
Sierra, do you have a question?
Mhm.
Sierra, you're on mute.
Like, just a comment, like a resource. So the Equal Rights Commission as well, if we are sending participants to programs, we can like do a report with them with the ERC, get them connected as a client, so then lawyers get involved. Because I know sometimes we'll send participants to like the DMV at their housing programs or just like wherever. And like if they are getting turned away or are turned away, there are like legal supports for the clients. And it's super easy. It's just the Equal Rights Commission is really great with that. Like if someone says, "Oh, you don't qualify for something," or you go and you get turned away, Equal Rights Commission, I'm just like plugging that because we know it happens a lot. But if we have participants who get turned away from like Virginia Williams, Office of Migrant Services, like anything like that, Equal Rights Commission is who we should be reaching out to support our clients.
Thank you for that feedback, Sierra. Are there any questions regarding language access compliance or random language access testings completed by Office of Human Rights?
Hi, this is Lena Bell with Preeminent. I just wanted to say really quickly, a free resource that's available for language translation is Word. If you have your Word document open, there's an option that says translate, and then it lists the languages that you need the document to be translated to.
Oh, wow. I never knew that you could do that via Word.
Yes, at no cost. So
Oh, well, that's
it's-
news to me.
yeah, it's under your list of tools, and then you hit translate, and it asks you what language.
Oh, wow. Thank
And
you
it
so much.
asks you if you want to just translate the section, a particular section, or the entire document.
Well, you learn something new every day because I certainly didn't know that was a feature in Word. So thank you
Yes.
so much.
No problem.
Yeah, this is Jessie with TCP. I would just be careful with that and any like translation services that are just like automated, they may like not be completely faithful to that. So part of the Language Access Act is that the translation and interpretation has to be done by like a qualified professional. So that might be a good first step, but you may also need to have that looked into by like a professional to make sure that it's faithful to the interpretation. And like if there are any documents that you like need on the fly that may not be like if it's a language that's not commonly represented or is less than, I think it's 500 individuals or 3% of the folks that you serve, if you need it translated into, I don't know, like if you have one client that comes in and needs something in Swahili, you would want to have like call the language access line, or sorry, the language line, and have them interpret that over the phone so somebody's not signing a document that they don't know what it says.
Thank you, Jesse, for that feedback.
Duly noted. And I was basically saying just for like simple forms, but like if it's like a contract or something where it can be misinterpreted, from one language to the other, then definitely not. But for basic things, and then of course always, utilize the language line.
Awesome. Thank you both for that information. Do we have any other questions on language access before we move on? All right, hearing none. All right. The part that I know that you guys already went off about, and you're probably going to throw tomatoes at your computer. New required monthly reports. So you guys were recently made aware that there are 2 new monthly reports. We already know that you guys already have a ton of reports to do to submit to us, and here we are adding 2 additional. But again, it's not our doing. It's a requirement from the Department of Human Services. So the staffing level report is a monthly report that is required for all programs. And this report is required not per provider, but per program / contract. So the staffing level report basically reports on your staffing numbers in each month. It lets us know how many full-time staff that you currently have for that, well, that you have for that month, part-time staff, number of case managers, number of program managers, number of social workers, etc. This report is required, no exceptions. It is required each month. It is it is to be submitted via a Smartsheet tracker. The link to that tracker is here. I'm sure Jesse will also put that in the chat. This report is due the 10th of every month for the preceding month. So that means your reports for January will be due by February 10th. If the 10th happens to fall on a weekend or a holiday, you can submit your report the following business day. Another monthly report that is required now is the grievance report. This report is required even if you guys have not had grievances submitted or investigated during the month. The purpose of this report is to report to TCP and DHS about how many grievances you've received within your program, how many were investigated, how many are still outstanding or still under investigation. If your program haven't received any grievances for the month, that's completely fine. There is a section on the report that allows you to put NA or 0. So again, these reports are required for all program types, all contracts, all programs, no exceptions. Similar to the staffing level report, the grievance report is also due the 10th of every month for the preceding month. So that means the report for January will also be due by February 10th. TCP staff has been really good with sending out reminders. So each month, maybe a few days before the 10th, we send out reminders to you guys because, again, we know that you guys are consumed with other things. So we send out a reminder about 3 or 4 days prior to the 10th to remind you guys that the report is due. So we will continue to do that to provide you guys with that reminder. Are there any questions regarding the new required monthly reports? I also want to note for the staffing level report, it is tailored to also apply to security vendors, food service contracts as well. So we do understand that security vendors or our food contracts wouldn't have case managers. So on the report, there are sections that are applicable directly to food contracts, security contracts, and things of that nature. So, like I said, again, this report is required for all contract types. So, I would suggest you guys to make sure that you put like a reminder on your calendars each month to remind you guys to submit this report. If you don't want to solely rely on TCP's reminders. And also save the link, like bookmark the links to these trackers on your web page or on your home browser thing, whatever it's called. Just so it's easy access. So you can just literally click the link, go right in, click, 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 and submit your report. Those are just suggestions to make sure you stay on top of the reports. And if you guys have any questions, you can feel free to reach out to me offline about these reports.
There's one question about this in the chat, Ashley.
Yep.
Somebody asked for staffing level report. If someone is allocated to that contract 10%, will that be reported as a full-time staff or part-time staff?
Are they allocated to the contract 10% and then another percent somewhere else? Like on another contract, or is that your only contract with TCP?
The first option, they are allocated somewhere else.
Is the client, I mean, is the employee full-time though? Do they work outside of the staffing list? Are they a full-time employee?
Correct.
Yes, so they will be marked as full-time.
Thank you.
Any
Yeah.
other questions?
Those are all the questions in the chat.
Okie dokie. Again, if you guys think of any questions after the meeting is over, you can feel free to reach out to me via email or phone. At the end of the presentation, all of our emails will be there for those who don't have it, for you guys to reach out with any questions. All right, monthly report reminder, shift supervisor. I will pass this over to Jenna Kearney.
Good morning, everyone. So for the shift supervisor reports, the form and the submission form can both be found on TCP's website under monthly deliverables. So this is just a reminder to include the provider name, which is your organization's name, not a staff member's name, the program name, and your FY24 contract number, as well as the signatures of the preparer and approver at the bottom of the report. So this is a requirement for all site-based programs, whether it's a management sole source or HUD contract agreement. And these are due at 5 p.m. on the first of each month for the preceding month. So the January shift supervisor report will be due today at 5 p.m.
Thank you, Jenna. Contract deliverables, I'll let you continue that.
Yeah, so for Content Snare, this is the platform that we use for contract deliverable submission. So all contract deliverables are to be submitted through Content Snare. Your program's point of contact will receive the initial email from Content Snare and will be prompted to create the PIN number for your contract's deliverable submission. With this PIN number, it can be given to anybody in your organization, so multiple people can submit deliverables at the same time. And so please do not email contract deliverables unless you are specifically requested to do so, because we want to keep them all in one place. And
Oh, go ahead, Jen.
yeah, so for your FY24 management contracts that have just been executed or are currently being executed, the following contract deliverables are required, not the entire list previously. So we will need your signed contract, your FY24 organizational budget, your initial budget 327 form, the budget narrative 328 form, staffing list 905, the employee background clearances for each staff member on the staffing list, your scope of work, the first source agreement 2 document and employment plan, if applicable, and the insurance certificate.
Thank you, Jen. And I also just want to make a note here. This is only for management contracts. So this does not apply to sole source contracts or HUD contracts. this only applies to management contracts. Management contracts lately have been broken down into increments of small contract periods. So all management contracts should have recently been issued a contract with a contract period of January 1st through March 31st. So we do understand it's a lot to request the full deliverable package for these small contracts. So we have modified the list of deliverables that we're going to collect for these smaller contracts, which is the list present here. Um, in Content Snare, it still has the other upload fields for the other documents, but just make a note that you will only need to upload the documents that are outlined here. I also believe that April Green sent out an email to the deliverable POCs, the finance POCs for our management contracts regarding this as well. But if you guys have any questions as you guys are submitting your deliverables for FY24 for your management contracts, feel free to reach out to either Jenna or Cody or myself. All right, monthly report reminder, fire drill log. I'm going to pass this to Cody Karoma.
Good morning, everyone. Okay, so for the monthly fire drill logs, each fire drill log or each fire drill report, I'm sorry, will be submitted through the Smartsheet link. All the reports is due on the 10th of each month, no later than 5 p.m. For the previous month. So like December's report will be submitted in January. January's report will be submitted in February. Hold on 1 second. Sorry, it just clicked off. So as you're submitting, well, as I've been reviewing, I've been noticing that instead of the contract number, sometimes you guys submit the contact number. So going forward, if you guys can just make sure that the contract number is submitted, that would be greatly appreciated. We do submit reminder emails to just let you guys know in advance, but and it's just for site-based programs only. Okay, for the FY24 hypothermia contracts, you just have to submit the contract deliverables that's listed below. So you're going to submit the signed contract, the initial budget, the budget narrative, the staffing list, and the payroll calendar. For the initial budget, the budget narrative, and the staffing list, can you guys just make sure that we use the most recently updated one, which can be found on our TCP website? For the TCP's deliverables, the payment clearance receipt form, after your deliverable package is reviewed, the payments receipt form will be sent to your agency's executive leadership as a receipt of the deliverable submission and the status of the clearance for the payment for your contract. Any deliverables that's required, some resubmission will be noted on this document along with the due date for resubmission. Failure to submit the deliverables to this on this required deadline or the resubmission deadline can result in interruption with the payment for your contract. Sorry.
Thank you, Cody. So passing this on to April, I believe, for contracting reminders.
Yes. Yeah, just very quickly, I don't have much for you all today, but just please note that once your contract is issued, you have 5 business days to sign and return your contract back to TCP. This goes for the hypothermia and management contracts that were just issued. We still have providers that haven't signed, and it's going on probably about a month now. So if you guys could just double check your inbox and make sure that you receive the link to sign your contract. And lastly, just make sure if you guys have any issues with your budgets, make sure that I'm CC'd in all correspondence so that I can get that resolved as quickly as possible.
I'm gonna just stop here. I know that we went through a few slides already. Are there any questions in the chat or any questions we can take here regarding deliverables or contracting reminders?
We have one question, which is, would it be possible for TCP to send out a master list of all reporting requirements with the due date and program model that is required to submit the report?
Sure, absolutely. We can actually have that sent out by tomorrow. That is a good idea. We can do that. Who was that question from, Jesse?
That question was from Mary Klingenberg, and we have a number of people that have seconded and are very excited about this.
Yes, Ms. Murray Bridget, we can have that sent out to all programs about the monthly reports. We know it's a long laundry list of reports, so we can definitely do that to make it easier for you guys. Were there any other questions?
No other questions in the chat right now.
Awesome. And passing this to the training team.
Good morning, everyone. My name is Cassidy Dykstra. I am one of the training coordinators, along with Jesse, who has been so kindly monitoring the chat for the whole meeting. We also just have a couple of quick updates. The first one is that there's going to be a training requirement change for the UIR training, and that is only relating to the management and sole source contracts. Whenever we issue the next round of management contracts, that change will take place. So the update is that the UIR training will now be required for new staff within the first 90 days of hire. We think most people are already doing this, but this is just going to be a new written requirement. And then the UIR training is also going to be moving from an annual requirement to a biannual requirement, meaning you'll just need to take it every other contract cycle instead of every contract cycle. So that then brings me to the next bullet point here, which is for management contracts specifically. So because the management contract periods have been a little weird for the past year or so, we wanted to specify the requirements for annual and biannual trainings based on those training transcripts and also what's in your contract. So as a reminder, when we're talking about the annual and biannual training requirements, we're referring to contract periods instead of a calendar year. And this is because our contract periods are typically 12 months, but like I said, the periods have been a little weird within the past year. So we just want to specify what the training requirements are then. So TZP is going to be combining the current contract period, which is January through March, with the previous contract period, which was July through December. So it's going to cover that 9-month period from July 2023 to March 2024. So that means that any trainings that were completed between July and March will count toward your training requirements. And then the compliance team will be monitoring completion for those required trainings for a minimum of 75% completion between that 9-month period. So again, if a staff member completed a training for one of the required topics within those past 9 months between between July 2023 and then March 2024, that will count towards the 75% requirement. So if a staff member completed, because we also have biannual topics that are required. So if a staff member has completed a training topic that's required biannually between July 1, 2022 and June 30, 2023, that training will also count towards the 75% requirement because of the biannual requirement. So I know that that was kind of confusing and it's a lot of dates and a lot of numbers. So we're actually going to be sending out an email with this same information so that you can look through it again and read it, which might be easier than me trying to explain it. So if you still have questions after that email is sent out about specific training requirements, you can contact the training team. Otherwise, if it's about compliance monitoring, you can reach out to Ashley.
Thank you, Cass. And as Cassidy mentioned, an email will be going out today to everyone, just outlining or explaining that breakdown. As Cassidy mentioned, it might be easier for you guys to read it. I know for me, I'm a visual person. So an email is going to be going out to everyone today with the breakdown of how those trainings will be monitored in speaking to that 75% and all of that.
And to answer the question that's in the chat, if it's an annual requirement and it was taken before July 2023, that means it is going to be expiring at the end of the current contract period, which is March 2024. So Sorry, I'm trying to visualize a calendar in my mind. Jesse, if you can, if you can help me
Yes.
out here.
Yes, and so the question is, what about for those those trainings completed before July 2023, are they expired now? So if that training that they took is considered biannual, so every other contract cycle, they can count it for their biannual requirement for the current contract cycle. If it was a annual requirement, meaning they have to take every contract cycle, if it was completed before July 2023, they would need to retake it for the current contract cycle. So, which we're kind of considering July 2023 through March 31st. So it seems like that's been resolved in the chat. Are there any questions about that? And again, yeah, hopefully it'll be a little bit clearer with the visual. And we're always happy to answer questions because we know it's been a fun transition, especially with the different management contract cycles there.
Okie dokie. CCP staffing changes. Candace, I believe this is you.
All right, yeah, so I did want to make sure that everyone knew about some of the staffing changes that happened at TCP, but since we've last met, Marshika G, who was our federal and community grants administrator, transitioned out of the position. I'm sure that if you have a HUD grant or some other community grant that is administered by TCP, I am sure you've probably seen the email bounce back by now. But she has transitioned out of her role from TCP, and we do absolutely wish her the best. So this position is now vacant at TCP. TCP is also looking to add another compliance specialist. So just keep those things in mind, that we know that our team is trying to work hard for you. So just give us a moment as we are working through some transitions and adding folks to the team to make sure that we do not miss a beat. Also, I know it is no secret, it's already happened. I want to say, I think our last meeting, I think we might have mentioned it, but as everyone on this call should be aware by now, that Jose transitioned out of his position back in October as well. So filling some of the role for some of those things that Jose worked on is Fred, and some of the other types have been split to myself. So if you need anything that you probably, if you didn't know, that you probably would have gone to Jose for, send it to Fred and myself. And that's it for staffing changes.
Awesome. So here's our contact information, and that is the end of our presentation. We do have quite some time left, so if there are any questions that folks have, we can take questions. And if we don't have any questions, or if you don't have any questions, you guys are free to go back to your busy days.
Don't leave just yet. I want to make sure that folks, I know that there's probably, as people are forecasting, the contracts will end March 31st. And I know folks are most likely trying to forecast. I've definitely gotten a couple of these questions already. Unfortunately, I'm not able to give you any more information regarding the contract. If you have a district management contract, we know that it's going to expire in March. So I wish I could give you more information on that, but as we are given information from the Department of Human Services, we will funnel that down to you. We do not know if we're going to go month to month, if we're going to get a multi-month extension, or what's going to happen. So unfortunately, for my finance officers, for my executive directors that are on the call that may be trying to forecast and plan for your organization, unfortunately, I'm not able to give you more information other than we're waiting for it. So I think in the chat, I see Are there any updates on the switch from HQS to Inspire? Ooh, you asking a good question. So currently we don't have any additional updates on the switch, but we do want providers to start transitioning. There are some new requirements that I do believe we have been sent out before Ms. G's transition out. I'll double check about that. But there are some hardcore differences that that need to be implemented from landlords, not necessarily the providers, unless you are the owner of the building. So I will double check to make sure that Ms. G did send that information out. If she did not, we can resend it. I do see there's another question. Any updates on program rules? Well, program rules. If you have a program that is funded by the district, your program rules absolutely have to be approved by the Department of Human Services. Not too long ago, well, in my opinion, it was a long time ago, but not too long ago, we did request draft program rules from all providers, with the exception of HUD, and I'll talk a little bit about that in a second. Those program rules that we received have been submitted to the Department of Human Services, and they are under review. There are some providers that did not turn in their program rules. So if you didn't turn in your program rules, we sent out the reminder like 30 times. We're not chasing it again. Your program rules will just be approved as is with updating the legal jargon. So that if you haven't turned them in, that ship has sailed. So I hope you turned them in. Now for HUD programs, those program rules are due as a contract deliverable. So when you turn in your contract deliverables, your program rules should be submitted in a draft form, Microsoft Word, in track changes. When we give you the payment clearance form, we will also return your program rules as they've been reviewed and approved. So if you have not received program rules for HUD as you have turned them in with your contract deliverables, then please send me an email. Please include your draft program rules and I will return those to you upon review. So those are the updates on the program rules. The goal was to have, when we started the program rule project with the Department of Human Services last year, the goal was to have all program rules returned back by January. It is now February. And as our dear friends of Bone Thugs and Harmony would say, it's the first of the month. And so we're supposed to have a meeting with, TCP is supposed to have a meeting with DHS to talk about where they are in this project. So hopefully I'll be able to email out to everyone some updates regarding if you have a district funded program, getting you some updated program rules really soon. I know it's been a long time. We are almost 10 years out because I think the last approval period was 2015. So I know that everyone is eager to get some updated rules. And the law changed in the midst. So I know you're looking forward to getting those.
I just want to go on record to say to TCP, I know that there are a lot of rules and regulations and forms and requirements and things like that. But I just want to say from the bottom of my heart, as a small business teaming with your organization, thank you so much for always taking care of us and making sure that we get paid. Hallelujah, praise the Lord. And not only that, but if we have any questions or if we have any concerns regarding any of the deliverables and so forth, you guys are always responsive to us and just kind of working with us. So I really just want to say thank you so much because, you know, as a small business, we deal not only with the district, we deal also with the federal government, and a lot of times it's not as forthcoming. So I just want to say thank you so much.
Thank you, Ms. Bill. That really means a lot to me, to our team, to the agency. This dream of ending homelessness could not be done without you and your partnership. And we know it's hard out here, and the best thing to do is to be a partner. And I appreciate everything that you do. Everyone on this call does. It's everything is all a piece of the big puzzle. And one of these days, there will be zero. We will not need a shelter. And until then, we need your help. And I appreciate and value our partnership and teamwork.
All right. I think if there are no more questions or comments, we are done. I think we were scheduled to 12, so we are giving you guys back a lot of your time to prepare to wrap up for the week and enjoy your nice long weekend. So thank you guys so much for joining
I'm sorry. Just
Uh-oh.
one quick question. You guys mentioned the one pager for transitional housing to change. Do you know when we should expect that?
Sorry, I was on mute. We're looking for it to be out by no later than the 9th. It's coming from the Department of Human Services. So I always like to give them a little grace. They said it was going to be the 7th. So I'm hoping the 9th, but it could be the week after that. I don't know.
Okay,
But
thank
I'm
you.
definitely, but sometime between the 7th and the 9th.
Okie dokie. Well, you guys have a good one. As we stated earlier, these slides will be sent out via email. Miss Mary Bridget, we were also going to take your recommendation and send out a memo along with that email with the list of all of our monthly reports, just so you guys can have that in one place. And we will also upload that to the website and update as needed. Hopefully, there's no more monthly reports added to that list, but we'll also send that list out along with the PowerPoint slides to you guys. So thank you so much for your time and for joining us. And you guys have a wonderful remainder of your week and weekend.